Welcome. I'm Mike Hedgie. I am in my 5th year at AWS. I like to say that I do epic stuff at Amazon. That's mainly because I came out of retirement after spending about 30 years at Epic. I was Epic's technical fellow. So what does a technical fellow do? Well, we looked at new technology for Epic's core system to make it easier to implement, easier to operate, and easier to scale. Now, in the past 4 reInvents, we've really focused on either running Epic on AWS. We've heard from Tufts Medicine, sharing their story on how they implemented Epic directly onto AWS. They were the very first organization to run production Epic on AWS. We heard from Geisinger Health in a 3-part series where they talked about their decision, their execution, and the results they received migrating Epic and non-Epic applications, what we call integrated applications, onto AWS from on-premises. And that brings us to today's bold claim. This time around, I think I want to put this out there. Running Epic on AWS has become standard practice, or at least it's becoming standard practice. And I'd like to be able to substantiate that claim for you. And I'm going to substantiate in terms of adoption, benefits, and results. Then we're going to pivot to what we're going to be talking about today, going beyond the EHR. So when I started with AWS in 2021, the Epic on AWS community contained two health systems, only 2. Tufts Medicine, which was known as Wellforce back then, and Central East Hospital Cluster out of Ontario, Canada. If we fast forward to today, there are 46 organizations in the Epic on AWS community. Folks from the United States, Canada, Australia, all live or implementing Epic on AWS. And when I talked to a healthcare exec about why, and he framed it very, very well, I thought. He said it comes down to, with these tight margins that health systems have to operate in, it's important to look beyond just benefits to IT. And he said there needs to be a focus on 3 benefits, and you guys deliver on that. He said the business benefit, the technology benefit, and the financial benefit. Now, I'll just step through what he had mentioned to me. And the important thing is these don't all have to be in balance like this triangle. They just have to be in harmony with each other. If we look at the business benefit, we're talking about agility, we're talking about experience, and we're talking about security, primarily. From the agility standpoint, being able to ensure that infrastructure isn't getting in the way of innovating for the populations that you care for, that infrastructure isn't getting in the way of speed of mergers and acquisitions, of divestitures. It isn't getting in the way of leaning in with Epic's Community Connect, where you're offering Epic to health systems that you have a clinical relationship with that can't necessarily get Epic directly from themselves. And the experience side of things, making sure we're demanding so much of our physicians, our nurses, in terms of documentation, making sure that they get a delightful experience running Epic. And then from a security standpoint, health systems are getting inundated with ransomware attacks. And having an Epic isolated recovery environment running on AWS gives us confidence that we can still continue to deliver informed patient care even if ransomware has taken our on-premises systems offline. We take a look at the technology side of things. It comes down to scale, resilience, and performance. When we talk about scale, what we're talking about here in Epic terms is something called global references per second, or GREFs. That's how Epic measures how much work is being run on their database. And Epic sizes their workload on AWS larger than any other cloud provider, and it's been that way since they first started sizing on AWS. In 2021, it was 8 million global references per second, or GREFs. 2023, it grew to 42 million. And today, 2025, we're at 140 million GRAFs. Now, you think about that, that's about an 80% year-over-year growth compared to a normal health system that grows on average 20% year-over-year. It's important to stay ahead of your growth. From a resilience standpoint, over that same time period, AWS has the best resilience record. And it's more than just service resilience. It's also about application resilience. The Epic on AWS architecture that we collaborated with Epic on is spread across 2 regions and 3 availability zones in each region. That's like spreading risk across at least 6 data centers. And then performance, making sure that you get consistent, excellent response times. And the way that you do that is, first, use fast technology that Epic approves. Second, use the newest fast technology. And then third, making sure that you are replacing your Epic stamps with the latest technology to make sure that you get consistent, excellent response times. That also helps to drive down some costs. It keeps the response time good and keeps your clinicians happy. Which brings us to the financial side of things. And Jeff Bezos once said that there are 2 types of companies. Those that work towards price increases and those who work towards charging less. We will be the second. If we take a look at the 116 as of July of this year, 116 reductions in AWS service prices. Many of you probably know that. But the focus on trying to save you money is something core to our culture. And we've seen organizations improve their operating margins. We've also seen organizations take some of that savings and start investing it into some innovative practices. So we've got those 3 benefits, and the results really speak for themselves. If we take a look at the KLAS research that's done with health systems, where they survey respondents on their experience with a vendor, AWS received the highest marks, and this led KLAS to award AWS with the best in class for public cloud in 2025. So what does all this mean? It means that, well, this is what I use to support the claim that Epic on AWS is becoming, or has become, a standard. And what we want to do now, this time around, we've talked about moving Epic to AWS in the past reInvents, but today I want to look at what are folks doing to improve their operating outcomes beyond the EHR? What are folks doing to improve their clinical outcomes beyond the EHR? What AWS services are folks using that include EHR data that really help improve care delivery? And so to answer those questions, we're going to hear 2 stories from 2 organizations, 2 speakers, 2 transformations. We are going to hear from Jupiter Medical and their experience with Amazon Connect. And we're going to hear from Rady Children's Health and their experience building a modern data platform. And then we're going to sit down and have a little fireside chat with them as we dive a little bit deeper. But let me introduce our first speaker. This is one of the pioneers of Epic's Community Connect program. One of the first organizations to implement where they share their Epic environment with smaller health systems, and now it's pretty much standard in all Epic health systems. Today, he is the Chief Information Officer of Jupiter Medical Center in Florida, and please welcome to the stage Kevin Olson.
The godfather, grandfather of Community Connect. That's kind of nice. All right, we'll go with that for today. Thanks. Again, Mike introduced myself. I'm Kevin Olson, Jupiter Medical Center CIO. I've been there for about 5.5 years. And for those that don't know about Jupiter Medical Center, we are in Palm Beach County, South Florida, just north of Miami, Fort Lauderdale, tucked up on the Treasure Coast of Florida. Very attractive place to live. People come there from the north during the winter to kind of play warm weather instead of cold up in the north. So we're going through that experience right now. So it's a great market. We've done some really cool things over the last couple of years, including our migration from to Epic onto AWS. So I can get the pointer to go here. There we go. So a little bit about Jupiter Medical Center. So very proud in terms of our independence. We're the only independent healthcare system in the area. We've got Tenet, we've got HCA, Cleveland Clinic, everybody's around because it's an attractive market. With that said, we're also very proud of our score in terms of Leapfrog A, CMS 5 stars, which really measure clinical outcomes, which is what we're all striving for. But that said, we all face these cost increases. Mike kind of referred to it a minute ago. Labor costs, supply costs, everything else going up. But then our reimbursement remaining relatively flat, maybe 2 to 3% in Medicare, but then the private payers follow suit, and they're kind of in that same ballpark. So it's a very challenging time in terms of margins in healthcare, and there's no really, light in sight in terms of this big pot of money sitting at the end of a rainbow. So we've all got to kind of roll up our sleeves and kind of figure out how to run more efficiently, effectively, et cetera. So for us, our journey was really to get away from this fragmented system we had. We're very proud of our outcomes in terms of clinical care. But the systems and platforms that we're utilizing and running did not reflect that. So we had very fragmented experiences for our providers, for our patients. So if you had a clinical visit in the hospital, you'd have to go to one portal. If you had a clinical visit in an ambulatory setting, like your provider, you had to go to another. And if you had to pay your bill, you had to go to yet a third. So our goal was really to create one unified experience for our patients and our providers. So in 2022, we decided to take the journey, make the leap, and go to Epic. Having gone through a few of these in the past, it was a pretty good little journey for us, with the overarching goal of having one experience for our patients, which was absolutely crucial. Because it's a differentiator. Again, competitive market, those costs increasing, reimbursement staying flat at best. So again, that was kind of our overarching goal, is to really kind of make that experience a meaningful one for our patients, world-class, as we say in our delivery of care. So that went well. We went live, but along the way, we recognized, hey, there's some additive technologies and benefits that we can take advantage of, one of which was Connect, not Community Connect, AWS Connect. And so we reached out to our partner at the time, our rep, and said, hey, Rich, we can do something different. We have got this really very old legacy platform. It's costing us $750,000 a year. We have a 9% abandonment rate because of folks just not getting the service that they're looking for. The analytics didn't exist. We had to sift through manual reports. Same time, we've got these very expensive diagnostic imaging modalities, CT, MRI, that are really not being utilized to their fullest. We're like 75% utilization as far as our imaging modalities. And patients are frustrated. They may get an appointment 2 weeks out instead of in a couple, 24 to 36 hours. So those are a couple of big deals. And again, the cost of running such a platform, a little bit extravagant in terms of cost. So we had every intention of making a change there. So again, we reached out to our rep, and we decided to put that into scope of our Epic migration. Fast forward to 2024, Labor Day of 2024, we went live, and we saw that radiology backlog really decrease. So 60% reduction in utilization of, schedules. Capacity utilization of those very expensive modalities, again, CT, MRI, 20% improvement. That's significant. So much so that we've got another CT that we'll be installing here in the next probably 3 months, I believe, is the target date. Our abandonment rate in terms of calls reduced by 50%. We're at about 4% now. And then again, the operating expense significantly reduced as well. So really good positive outcome. So the next piece of this is, where do we go next? So as we continue our journey in terms of, patient engagement, patient satisfaction, creating that world-class experience, there's other additive benefits that we found along the way. Mike mentioned IRE. We've got the marketplace to buy underlying technology, but really think about what is next in terms of AI enablement, experience enablement for the patient. We're really looking at some at-home functions where I'm at home, I need to get to a clinic, what's the closest one, what's the best one, how do I get there fast, what's the directions, Can I integrate that with my chart somehow to kind of do the navigation and get information into the portal? So that's something that we're looking heavily at currently as we speak. There's a lot of other things outside of the patient experience space in terms of technology, but that is a huge, huge one for us that we're looking at. Because again, the competitive landscape, it's not getting any less competitive. UHS has a hospital they're building. I can almost see it from my office, not quite, it's a little bit of an exaggeration, but it's close. And so, it's getting tighter and tighter, and we want to keep our independence intact, because we're wildly emphatic about keeping intact and profitable. So that's a big deal for us. So that patient experience, clinical outcomes, 1 and 2, if you will. So more to come as things develop. One thing, kind of a key takeaway, as we look at the technology, underlying technology, and we hear this in the press and we hear it all over the place, well, AI is going to displace folks. Healthcare is a very human experience, right? Take care of our bodies, and it takes a lot to kind of traverse the system. It's difficult. Talking to insurance companies, going from one care setting to another, whether it's off-site, off-campus, onto a main campus, it's difficult. So our intention is really to make that as seamless as humanly possible for every patient that we serve in our community. So with that, I'll turn it back over to Mike.
Thank you, Kevin. I'm looking forward to...
Thank you.
Take a seat over here.
Okay, thanks.
Look forward to diving a little deeper in the Fireside chat. I'd like to introduce our second speaker. She's was a literal rock star in a previous iteration of her career. Rockstar meaning Rockstar Games, Grand Theft Auto. She has taken her experience and brought that into healthcare now. And she's the Director of Integration and Analytics at Rady Children's Health, Caroline Pega.
Thank you so much. Let's do it. So I started at Rady Children's Health 2 years ago. And the first question I asked was, where's the data? And the answer I got was, everywhere. Some data was hosted by third parties like Cerner or our legacy data platform. Some data was on SQL servers that were managed by IT in some basement room. We all know those rooms. And most of the data was in dashboards, emails, laptops, and people's minds. Our data was like 1,000 puzzle pieces spread across different tables. Every piece being beautiful on its own, but we didn't have the full picture of a child's healthcare at any point. Every click, every email, every login, every data extract cost us time. And in pediatrics, seconds matter. When a clinician has to wait for data to load, the patient has to wait for their care to move forward. And that's what we are fixing. So we started building the digital nervous system at Rady Children's Health. It's a living, learning ecosystem where data flows freely and securely from bedside to boardroom to the research lab, where insights are available as fast as our patients grow. That's the transformation we started. The first thing we built, was our new data platform Mosaic. It's a cloud-native platform built on AWS and powered by Databricks, Tableau Cloud, and GitHub Enterprise. It's governed, it's scalable, and it's ready for AI. Databricks is the engine beneath the hood. That's where our data experts prepare, transform, model data at scale within one single workspace, so everybody's collaborating. It's also the space where we have our Ask the Data functionalities. That's when a non-technical person can ask questions in plain English and explore a data set. Imagine that. It's democratizing data science responsibly and securely. Tableau Cloud is our facet of our Mosaic platform. It's where clinicians, analysts, and operational leaders can access visual stories. And these dashboards, instead of having outdated extracts, have access to fresh data. It's also where they can all collaborate, share, develop new dashboards, and also publish them within the guardrails of our data governance. Elation is our brain trust. That's where we document all our KPIs, catalog all our data, and where tribal knowledge is finally available and certified. There's also the functionality to ask in plain English questions like, where can I find asthma cases by zip code? And get an answer in plain English, where you get the data steward, the data set, and the business KPIs that you are probably going to be wanting. Finally, we have AWS. And AWS has all these tools, Athena, Glue, SageMaker, and it's the playground for our research and innovation. Our researchers are able to experiment, analyze, develop models at scale. All of this is collaborative with cross-functional and other institutions, but at the same time, they can do this within hours and minutes rather than waiting for infrastructure to happen with IT. That's going to be long. So this data platform, it's where governance meets empowerment. All these tools enable creators to innovate, researchers to develop faster, and users to have access to insights faster. But our journey to the cloud is not just about technology, it's about partnership. And AWS was our partner in moving from a concept to the reality. They actually co-invested in our modernization efforts, making us innovate faster. We had an AWS architect within our sprints who was helping us develop our architecture, making sure that we could always track the cost of whatever we were going to build, and building an infrastructure and an architecture that was really secure and HIPAA compliant. And then finally, AWS helped us design this environment that's HIPAA compliant and secure, making sure we could encrypt everything that had role-based access, and also that everything was embedded. So when our data engineers had to create new pipelines, this took hours instead of months. Then there's our RCH chat. It's our private generative AI assistant that we've built in the same AWS ecosystem. It's on Claude 3.5 and has RAG models, which are retrieval augmented models. They don't guess the answer. They actually go within our internal knowledge base and gets the information from our policies, operational documents, etc. So when somebody asks, what's the reimbursement policy for education? The RCH chat gets the answer from the appropriate approved policy. Or when somebody asks, what are the social media do's and don'ts? Again, it retrieves and reference back to the security and compliance policy. It saves people time, that's for sure. They can leverage this chat with sensitive information and feel secure that the data stays in our ecosystem, there's no hallucinations, and every private chat is logged and HIPAA compliant. So it's really a dream for everybody. I got some feedback. Somebody said it's like having somebody 24/7 available to help me and that doesn't judge me with all my silly questions. So that's the kind of adoption we can only dream about, right? It's amazing. So now we're in front of the next wave. Yeah, I know, more. So it's the merger between Children's Hospital of the OC, CHOC, who hired me 2 years ago, and Rady's Children's Hospital of San Diego. And also, because we like to do this to each other, we're going to Epic. So within this merger, it's an opportunity to really reimagine everything, right? We'll be able to ask ourselves, what applications truly serve patient care? What applications need to evolve? And what applications should go to the cloud? And we want to be cloud cloud smart. We don't want to be cloud everything. AWS taught us that infrastructure is strategy. So we want to make sure we place things where they're the best, whether it's being secure, cost efficient, or just more efficient in general, right? So we'll use that lens as we take both systems from both organizations and create this connected ecosystem as we merge. And then Epic, with the native interoperability and the fast data updates, it's the perfect anchor for our platform Mosaic, AI, and advanced analytics capabilities. This is where our data strategy merges with the clinical strategy. So what would the future look like? Imagine a researcher wanting to develop an early stage diagnostic model for congenital diseases. And he goes to our platform Mosaic. The data is curated, so ready to go. There's all these amazing tools for them to build the model. And they build something within, minutes, maybe hours? What about the clinicians that need to know what's the readmission rates in these clinics for the last 3 months? They go to the RCH chat, they ask these questions, within seconds, they have a trusted answer. And finally, imagine the supply chain manager that gets proactive alerts when the stock is low, and then they can make timely decisions. That's what we're doing. That's the digital nervous system we have built. So what's next? There's 5 facets. The first one is application modernization, which is looking at everything that we have as organizations and making sure we're making the correct choices with regards to cloud fitness and just applications in general. The second one is our data fabric. We want to make sure that what we've built for CHOC is going to integrate with what we have at Rady Children's Hospital and create this world of data science and AI. There's sustainability. We want to make sure we optimize our costs, our operations, our storage, everything that has to do with the cloud. There's AI enablement, so we want to add some RAG models and agentic opportunity to our RCH chat. And then finally, there's community. We've started to build this vibrant data community where people learn and grow together. And that's really, really important for us to continue building it and making sure it thrives. So I know, it's a lot. The merger, AI, the cloud. Change is scary. But for us at Rady's, we've decided to, go above and beyond our fear, right? Because fear is just curiosity in disguise. It's the feeling that you get just before you learn something amazing. So we decided to try, to fail fast, and to learn faster. And we built with our partners, and we built with trust. Our journey was not about technology at the end. It was about courage. The courage to move from comfort to clarity and to believe that empathy and innovation can go hand in hand. Because every time we push a byte in the cloud, or we publish a dashboard, or we create a chat prompt in our RCH chat, what we're really, really doing is getting better care faster to the children. And that's what technology should do. It should amplify care. And the future at Rady's, thanks to our partners, our colleagues, and also our team members, is now. So here we are. Thank you. Michael?
Thank you both for your presentations. I'm looking forward to diving a little deeper with you. Kevin, I'll start with you.
Okay.
I love that metaphor that you shared about being able to see that construction happening. How does the immediate competitive pressures really shape your technology decisions?
Carolyn kind of alluded to in her presentation about change. I think some folks are locked tight that they don't want to change. And I think you've got to look around and kind of look at the landscape of the competition. What do they have in terms of, I talked about the patient experience a little bit today, and what do they have? and try to investigate how do you make it better, and I just think it's crucial. And San Diego is competitive as well, I know that, but South Florida, where I'm at, is very competitive. And so keeping those creative juices flowing, ready to embrace the technology that can make change in a positive way for the organization is crucial, and we'll keep doing that as we go forward, for sure.
Yeah, wonderful. Carolyn, keep on the theme of transformation here. You've led some significant change at Rady Children's Health. More to come.
More to come.
What skills and organizational changes were crucial to execute this transformation? Really, how did you build and develop your team?
Oh my God. I think the number one was communication and collaboration. I think from my experience in arriving in healthcare and definitely in my organization, there was a lot of silo. There was a lot of silo of work being done by my team or other teams, but also a lot of surprises, like here you go, this new thing, right? So what we really focused on was really getting our stakeholders, whether it's physicians or our rev cycle people, started with us in the project as we started. So at first they had no idea what Platform Mosaic was and why they should even care, but we still tagged them along with the correct, messaging for sure. We don't want to make them completely confused, but we really brought them along the journey, like at every single step, including the steps where they needed to be more involved. And at the end of the day was teaching our team members to do so and to be more collaborative, because at the end of the day, they should be serving our stakeholders and really understanding their business as much as possible and being, their buddy. I call it the buddy system. So we buddied up.
Oh, wonderful. You both mentioned the human element of this here, which I like to think that's a transformation or transition into AI, what I like to call augmented intelligence as opposed to just artificial. So, Kevin, you emphasized using AI to augment rather than replace human interaction. Can you give us some specific examples?
Well, certainly the connect piece, that's not to displace a human, but it's certainly to add efficiency to their work, their everyday work. At the same time, have data to make changes in terms of interactions with a patient, capturing information, whether it's some sentiment analysis that came through that may not be as positive as we all would like, but to do that in a little more close to real time. And that's an enabler. That's not just a displacer of people. That's just enabling more human efficiencies. That's one. Supply chain is another one we'll be looking heavily at. We have Workday, but we want to look at some other things in terms of operational choices when it comes to supply chain replenishment, because behind labor is supplies in terms of expense in any healthcare organization. It's just the fact of the matter. And like I said in my presentation, reimbursement is a little bit 2 to 3% maybe, but it's not getting it any tougher or any easier. And so I think the enablement of processes through AI, or whatever we're going to call it, is just crucial. And I think the successful organizations are going to embrace it and not take this kind of fear, tactic or stance going forward. So it's an interesting time, for sure.
I've heard it characterized as expanding human capacity.
Yeah.
With the folks that you do have.
Absolutely.
I love it. So, Carolyn, with RCA Chat, you're building a similar human-centric approach. With all the concerns around AI hallucinations and accuracy, how did you gain clinician trust in the system, and what guardrails did you put in place?
Did quite a few things. The first thing is really, relate our RCH chat to their previous experiences with any chatbot, if they have any. So we try to tell them it's the same as ChatGPT or any other chat that you might be using, where there needs to be a human in the loop. You need to be looking at this critically, right? It's not different, it's the same. For those who have no experience, and there are some, with any chatbots, it was all about onboarding them. So we really took the time to hold their hands through sessions of what this can and cannot do. Unfortunately, you can't think about all the use cases they could be using this for, but we did it in a way that was really creative and fun, so they could start thinking about how they would use this in a way that makes sense, and to your point, they can be critical about. It's for sure, like any type of RAG models, we definitely did a lot of validation, and we have performance monitoring on our models to make sure that they don't drift and such. So we're very invested in that. But for the chatbot itself, it's all about like education and just making sure they understand it's not like 100% accurate.
Okay, let's move from technology to some of the tangible impacts that you're seeing. Kevin, you mentioned some remarkable results with Amazon Connect, the 50% reduction in abandoned calls, for example. What surprised you most about the operational impact within the first 30 days?
The level of adoption. It didn't, a little concern about, change in terms of the team. And so I think they embraced it. They took a hold of it and owned it. I failed to mention in my presentation, the thing that kept me up at night too is like, we've got a growth strategy, right? So we've got a new patient tower, we got a new surgical institute that just opened up, and a new hospital we're building. So those incremental pieces like this we're talking about, if you can set aside the worry of those operational initiatives and tasks are huge. So the embracement of the technology in terms of the process change for the team was a welcome surprise in a really strong way.
And Carolyn, you're democratizing access, but with data.
Mm-hmm.
How do you balance making data accessible to non-technical users, like you mentioned, that's awesome, with ensuring HIPAA compliance and proper governance?
Step one was governance, right? We don't give access to anybody at any stage if we don't really understand what they have access to and what they can do with it, right? So this is really a stepwise exercise where we identify groups of people who can do things, and then we enable them. So we started originally with discovering there's a lot of power users within the organization that were actually new SQL, new Tableau. We're doing this either by their own in a silo or in their previous organization. So how do we enable these people? So we built the governance for these power users on how, what data they can have access to, what tools they need to have access to. We built policies, we built a community, we built, best practices they have to follow. And definitely as they publish, we built this governance of the quality. So they can't publish a dashboard for broad use without coming to our team and going through the process we would go through as we were publishing our own data products. So that's the power users. Anybody else, whether it's with Elation or GitHub, just giving GitHub access, it's all about education and the use cases and building that relationship so they come to us when they have new use cases, or they actually tell other people to come to us because they have use cases. So we really want to make sure that the people who want to do things feel welcomed to come and see my team instead of the traditional IT. I don't want this. I don't think that's really beneficial for any organization.
I love that. As we look to the future, 33% capacity coming, is that what you were saying? What's next on your innovation roadmap? You shared a little bit of that, but I'm wondering if you could maybe dive a little deeper.
Yeah, I mentioned supply chain earlier, but I think regularly different partners will reach out. So spoke to a partner last week about some technology that they're utilizing to enhance their robotics, right? So I won't name the name of the vendor, but it's probably if you're healthcare, it's probably in your institutions. But working with those partners to kind of help our surgeons in terms of how to provide more efficient care, timely care, and the sooner you're discharged, the happier your patient is, right? So with low morbidity rates, all those kind of things that we're measuring on a regular basis. Those are exciting things, and so that's one that's keen interest to our team for sure.
Cool. Yeah. Carolyn, looking forward, how are you approaching the integration of traditional data sources with newer sources like genomics, social determinants of health, and IoT devices?
Yeah, so the platform mosaic we've built is really with the vision of, we want to be modular. Things are going to change. For genomics, for instance, what's the best way to house the genomics data or use the genomics data? So we have that use case currently where we're evaluating our partners, evaluating capabilities, evaluating our use cases of today, but also the future. So for every new use case, we think about what's the best out there or what's the almost best out there, and then let's take a look and see whether or not we need to modify our data platform or use what we have already and build the guardrails for that. So it's all about trying, right? Making sure that we have those moments with new vendors that want to showcase how great they are with genomics or images, for instance, and understanding what they do versus what other partners do, and where we stand with regards to that. So we built a platform that's modular, that's future-proofed basically, and we can always build on it and change. That's important. We're not locked in, if that makes sense.
Sure does. So before we close, I want to ask you both for a little bit of practical advice. Kevin, I'll start with you. For those considering a similar journey to yours, what would you do differently if starting today?
For us, well, you showed a stat early in the introduction about those that have moved Epic to AWS or went direct with their implementation. We were talking about this earlier, so just do it. The fear of failure, in this space, I think has been quite a bit diminished. Probably couldn't say that 5 years ago, a little bit earlier in terms of adoption, but just doing it and then kind of recognizing that the additive features that are there on the platform that we've taken advantage of just in a small scale. I think we're just scratching the surface on what we can do. But the starting point is just do it. Just get it stood up and see what's there and jump on and go for the ride. That's kind of where my mind goes answering that question.
I feel like putting on a pair of Nikes or something.
Yeah.
Carolyn, what's your advice? What's the most important piece of advice you'd give healthcare technology leaders in the audience? What should they look to do, say, Monday morning?
Probably a culture change, right? So I feel like there's definitely a lot of, thinking about risk, right? Everything's risky. It just freezes everybody. And coming into healthcare, that was the first thing I observed. Everybody's like, nope, we could do this because all of these things. I think it's a change of culture of why should we do this? And what's the benefits? And moving from there, we can address the risks. The risks shouldn't be the first thing we think about. It's what's the benefit? And then you tackle the risks. And if at the end of the day, all these risks make no sense, then they make no sense. But it shouldn't stop us to be creative and research and think about new things. Because at the end of the day, the world is going fast besides us, and we're just looking at it pass by. And at some point, it's going to be a really huge change if we don't start today with changing how we look at things, look at curiosity, look at trying things out. And I think for me, what I instilled in my team was the Friday, figure out day kind of vibe, where you on Fridays you pick a topic you want to be curious about and you try it out. And you have to come back to the team with your findings of what did you try out and what was the outcome, right? That's a big culture change in healthcare, in my opinion, from being there just 2 years, to really change from negative to positive.
Yeah, I think we've heard the term, especially outside the industry, of failing fast.
Yes.
And that's scary in healthcare because failure could affect patient lives. But I think there's this concept of one-way doors, two-way doors, right, in your decision-making process. Definitely want to take your time on the one-way doors where you can't go back, but there's so many different two-way door opportunities out there to just try. Yeah. Just do it, as you mentioned. So we'll close on that. Folks, you may have some questions that you want to ask Caroline and Kevin. What we're going to do, though, is we're going to meet over on that far wall afterwards. We can take the microphones off and get ready for the next session up there. If we want to carry the conversation out in the hallway, we can. But both of you, thank you so much for sharing your insights, sharing your stories, your experience. It was wonderful to listen to. I've learned some things. And thank you. Hopefully you've learned a couple of things too. And with that, we will adjourn. And questions, we'll meet at the Fireside over there at the end. Okay, and please fill out the session forms on the app. Thank you.
Thank you.